Okay, so let's get into some of the most common symptoms that my perimenopausal patients come in complaining about. Now, there's a whole variety of things that can happen, but what I find is some of the most common issues that women will come in with are things like anxiety, depression, insomnia, hot flashes, another big one, and then this mental effect that perimenopause tends to have. I would generally call it brain fog, but it could span anything from poor memory to difficulty focusing, or those moments where you just simply forgot what you were going to do, and that's an abnormal finding for you. And it's a very troubling thing, of course. Now, these are just the primary concerns. I mean, there's a lot of secondary complaints that'll come with this. Generalized pains are very common. Digestive problems are common. PMS and menstrual cycle issues are still a problem there. Of course, night sweats, maybe even like sexual dysfunction, like low libido or excessive dryness during sex are big ones as well. But I'm going to really attack these or address these top five there. Now, the first thing that I like to do is I use a combination of herbs that will really address the entire picture, help in reducing symptoms, and of course I want it to be tolerated very well and provide relief beyond the treatment period itself. So if I treat for 3, 4, 5 months, that's great, but I want that relief to last for much longer than that. And that's really what's important here. Now, the first thing that I will generally add when I'm looking at this constellation of issues around the perimenopausal time is I will use a formula that is one of the most prescribed herbal formulas in the entire world. It's called Xiao Yao San. Now, this is basically a gut-brain axis formula, which means that it works not only by just alleviating mental emotional issues, but it also is well researched for its effect on the gut and functional related gut problems. Now, where this is very important is that when you're dealing with something like depression, anxiety, maybe memory problems, the majority of the neurotransmitters that we produce are produced in the gut. So if you've got gut-related problems, it could be from your diet, it could be from excessive stress. I mean, we know that this age demographic has spent years taking care of families and dealing with chronic stress, but all of these things will contribute to disharmony and dysbiosis in the gut, which can have a negative impact on neurotransmitter function, which of course leads to chronic problems like depression, anxiety, and insomnia. So anything that we can do to improve that is going to be very important. So using a formula like Xiao Yao San, which works not only on the mental emotional side of things, but also works on the gut side of things, can help in producing a much longer term effect than just while you were taking the medicine itself. Now, if we get into the research on this, the research on Xiao Yao San is fantastic and shows that it may actually be more effective and safer than hormone replacement therapy, meaning it's going to have less risk of side effects, and there are less incidents of people discontinuing the treatment due to things like side effects or adverse reactions. It's also very helpful for things like hot flashes. The form of it that I use, I actually adds a couple extra herbs to it, which helps with things like irritability, that kind of short-temperedness, and it actually helps in cooling the body more than Xiao Yao San alone. Also, research on it showing that it's works just as well as some antidepressant drugs, and again, with less risk of an adverse reaction, which is very important because if you're going to be taking something, the last thing you want is to get another symptom on top of what you've already got. And in Chinese medicine, having side effects is sort of against the name of the game. The key here is that you want everything feeling better. So the next piece of this is very important because in any aging population, and in perimenopause, it's no different, any aging population, there's an increased risk of cardiovascular disease. And this especially happens with menopause because now we don't have that monthly bleed anymore. So the risk of cardiovascular incidents comes up by a huge margin. So when I treat the cardiovascular side of it, the other effect of it that I notice is it tends to help with depression, anxiety, and insomnia and energy levels. So not only do you gain this benefit for the cardiovascular system, but your symptoms get better as well. Now, there's a combination of a couple herbs that I really like to use. They're Mao Dong Qing and Dan Shen. These actually have been researched to show that they improve blood flow into the coronary arteries, into the heart itself, which is a big deal. And Dan Shen, the second herb that I mentioned there, is especially well researched for perimenopausal or menopausal aged people, in that it has a profound effect on estrogen. Now, it acts like a selective estrogen receptor modulator, which basically means that it will block estrogen from things like breast cancer tissue, so helping in prevention and treatment of things like breast cancer tumors, but it improves estrogen in bones and actually helps in preventing osteoporosis and actually forming new bone. Again, another fantastic herb. It's great for the cardiovascular system. It's great for calming anxiety, calming the mind down. But then we see the effects that it has on improving cardiovascular health and improving the way estrogen works in the body as well. Now, the last piece that I really get into when it comes to perimenopausal age issues is I use a formula called Wen Dan. Now, to the untrained eye, this would look like a digestive formula, and it is to a degree, but it was originally designed for its effect on the mental emotional system, on psychology. So it's very well researched and very effective for things like anxiety, insomnia, depression, but it's also fantastic for refluxing conditions like GERD, stomach reflux, bile reflux. And if you were to look further at the research, you'd find that it has a huge number of effects on the cardiovascular system. It improves things like blood lipids. It improves something called blood rheology, which is how blood flows through the body. It improves or attenuates plaque lesions that form from cardiovascular damage. So this combination of things is really addressing sort of the whole system from a symptom standpoint, but we're also looking at it from improving things like how the cardiovascular system is working, how the neurotransmitter system is working, how the digestive system is working. And this is a basic approach that I use with almost all of my perimenopausal aged patients because it works well, it gets rid of symptoms, and it provides long-term relief even beyond the time that I'm treating them.